beginning of COVID, I really appreciated the education and reassurance, and I absolutely loved the webinars. A silver lining for me is just the technology. There's so much information there that is easily accessible. I feel more in control of my healthcare because I have more information, and want to say thank you so much again for all the reassurance and the support.
I'm a kidney recipient. I had my transplant in 2018. I'm also a disabled person on full-time on a wheelchair. On the onset of this pandemic, I didn't have to be so stressed to get up in the morning anymore just to prepare, because it takes me about 2.5 hours to get myself ready, being a wheelchair user. I don't have to wait too long for my handy darts to come in and order to take me home. So those are the instances where a lot of things has changed. I saved time from all the ways that I have to do. I have lesser stress, including my caregivers and my family. Now I have a lot more time as well to educate myself, to understand better my condition.
One positive experience that I've had during the COVID pandemic era has been that kidney care clinics have continued even though we don't see each other in person. So for mine, we did it by phone. So I had my blood work done, got the results, and then I talked to the nurse. We went over my blood work, and I took my blood pressure at home, and we talked about that. And then I talked to the social worker on the phone, I talked to the dietitian on the phone, and then my nephrologist called me on the same day. So it was a good experience because it felt like just like regular kidney care clinic, only it wasn't in person.
The positive aspect I have experienced in the opportunity to pedal a modified stationary bike while having my hemodialysis treatment. We keep track of the kilometers and the time that we've ridden. We've ridden across Canada. I feel it really helps to take your mind off of what is happening, the feeling of being down or being scared or worried. It's just a good time to not think of anything except pedaling a bike, thinking about where you are.
Nurses up here have always been a scarce resource, and with the COVID popping up, we were having nurses being taken out of the rotation, which was resulting in a lesser quality of treatment for my dialysis. And it was suggested to me by one of my nurses that there was this program, the home hemodialysis, available for those that were interested in it. So after a couple of phone calls and a couple of visits from Susan, my nurse coordinator, who's an amazing lady, we came up with a plan for me to head down to Prince George for a 3-week course that I felt quite comfortable in taking. And Susan walked me through the whole process, made me feel confident about doing this process, and it's where we are now. For me, that is a fairly positive outcome of this COVID-19, was the opportunity to be able to be at home.